So an overview of what our presentation tonight includes. We are going to talk briefly about the guidance and where that guidance comes from, as well as really looking at our local health metrics, which really are the driving factors for our decisions. We want to talk about what our purpose is, what our focus and goal is for returning to school this year. And then we want to dive a little deeper into our mitigation strategies and give a pretty in-depth review of our quarantine protocols and the guidance, because as we know, that is the one factor that takes our students out of school. So we want to be very clear and informed about what those protocols and procedures are. And then we want to hopefully shift and talk about our focus on learning, which is why we exist and why we are here. So hopefully we can really shift our focus to back on learning, and then end with talking about our commitment to continued communication. So I'm going to turn it over to Mr. Lula for talking about our guidance and from our local health metrics.
Thank you, Dr. Bresnahan. Yes, my focus tonight is just to walk through some of the data we have and the guidance that's come through, especially these last few weeks. So this piece, as I'm sure you all know, from last year, Illinois currently is in phase 5. We have been in phase 5 for an extended period of time, and basically things are as back to normal as possible. I think the important piece to know about the phase 5 piece is that that last piece where it talks about schools and places of recreation can open with new safety guidance and procedures. So that's been something we've been receiving all summer. We actually received some updated information from IDPH and ISBE today in relation to the FAQ document that they've distributed throughout the summer, and really the update just aligns fully to the CDC recommendation that was released last week on the 27th. Throughout the summer, IDPH and ISB have been basically adopting the CDC guidance in full as soon as it's released. This last piece from CCDPH, that's the Cook County Department of Public Health, what was interesting with that, while not released in a massive thing in the press, as school districts have studied it, found that last sentence where it talked about the use of should in the guidance, that's referring to the CDC guidance, does not imply that the strategy is optional. And I know that's caused a lot of school districts to consider their plans as previously should was interpreted as optional. At least this is from the Cook County Department of Public Health. And then finally, something we did all of last year and will just recently started up in July, we track our local data. So this website that Northwestern put together last summer really takes the daily data related to testing, COVID testing, and turns it into where you can see what your local school or zip code community data looks like. So we've started tracking and accumulating that data. This is the last 5 days of available data. As things have changed, they're no longer updating the site every day, especially on Saturdays and Sundays. So that data accumulates. It should be in by midweek, and we'll update again. But this shows where we're at currently. This is related to the CDC thresholds. IDPH previously last year had some different numbers, but low transmission is less than 5% positivity rate and basically under 10 per 100,000 incident rate. So you can see over these last 5 days of reported data, the positivity rates have been in low transmission. I think we've only seen 1 day over the last month that was in the moderate transmission in any of our communities. The per 100,000 rates, that looks a little different. It's been in the moderate, and then these recent into the substantial range. So that's the data. That's where we're at right now. You can see some of those numbers are fluctuating up and down. We'll continue to track those on a daily basis to help inform our practices as we move forward.
Thank you. So before we go into some of the more specific mitigation strategies, we wanted to take an opportunity to really celebrate and highlight a lot of the things that are already a return to typical in a standard school year. So last year, as you know, we were in that hybrid schedule. We had limited in-person learning. Our focus this year and our commitment is to a return to full in-person learning 5 days a week for all of our students. Last year, we weren't able to use our playgrounds and shared equipment. This year, we have a full return to those playgrounds and recess and being able to utilize that. We've already seen it in daily practice at our Ridge School as well. Last year, we weren't able to have visitors and volunteers in our building. This year, we are going to return to that practice, again with some safety protocols, but being able to welcome those people back into our schools. We had very limited, if no, extracurricular activities or our in-person family events. We weren't able to use our lockers, our cubbies, the kids club. We are seeing a return to all of those things for the start of our school year. And again, we're going to continue to monitor the health metrics to ensure that we can do those safely. Last year, we had to do the daily self-certification for all of our students and our staff through an online form. This year, we're continuing to ask all families and staff to monitor for any symptoms, but we are not requiring a daily certification form. The quarantine protocol is an area, and we'll go into more detail later in the presentation, but really that's been a major shift from the Cook County Department of Public Health, who really monitors and manages our quarantine protocols. Last year it was a standard 14-day. This year it's been reduced down to 10 days in specific cases, depending on our mitigation layers. And there may also be some exceptions that we're able to take advantage of this year that would be new. Last year, we had to limit our bus capacity to 50 individuals. Masks were required. This year, the capacity limit based on COVID no longer exists, but masks continue to be required without exception on the bus per CDC. And then we're very excited that we have a full return to our typical hot lunch program and resuming those services for breakfast and lunch for our students that participate in that. So a lot to celebrate, and all of these things right now are currently up and running for the most part in our Ridge Family Center. So the main purpose, our goal, when our administrative team got down to really thinking about what is our purpose and what are we really trying to ensure that we can maintain this year. And that was to open our schools in a safe way, provide the best learning environment that we can, and continue to keep as many students as possible in person. And with that, then we started looking at everything and the impact so that we could be here and discuss it with the board this evening. But this remains our primary goal as we built the plan. So we had to ask ourselves, what does it take to keep our kids in school? And after reviewing all the health guidance from all of the organizations that were shared previously, there are three main mitigation factors that have been shown to keep students healthy and in schools. The first being vaccination, the second being the use of masks, and the third being physical distancing. Again, each one in isolation, maybe not be independently foolproof, but looking at these things in layers is what we hope to be able to achieve in order to keep our students in school. So looking at our mitigation strategies, the first one that we're going to go into detail on is quarantine, because quarantine is what takes our kids out of school and out of in-person learning, and that's what we want to avoid. We do not establish the protocols for quarantine as a school district. The Cook County Department of Public Health actually maintains the authority and the guidance. So when a positive case is shown in our schools, we then contact Cook County Public Health Department. They ask us a series of questions, we provide them with information, and they assist us and tell us what we should do in terms of who should be quarantined and for how long. So again, the things that we have the most impact on as a school district is being able to reduce the likelihood of quarantine using our mitigation strategies. So the new close contact exception is really one of the most significant changes that we're seeing out of the Cook County Department of Public Health, as well as IDPH, as well as CDC. And this is a really important part because remember, 6 feet used to be the golden rule. If you were closer than 6 feet with masks on, you were considered a close contact and therefore led to quarantines. Now what the CDC has shifted to is between 3 and 6 feet. So as long as you're that 3 foot apart, then we're able to look at close contact in a different way. But there's some criteria that have to be met in order to utilize 3 feet. And that means that both students who are engaged in the contact have to be wearing masks. So if one is not wearing a mask and one is wearing a mask, both students are now considered close contacts. And we'll get more into details of examples of how that works. But that's a really key piece that we had to sit with and digest and really understand as we were looking at the impact of the decisions. Then we also have to look at our other mitigation and prevention strategies and ensuring that those were in place in order to take advantage of this exception. So with that, I am going to turn it over to Dr. Ossil, who's going to walk us through some more specifics around quarantining and close contacts.
Thank you. So I'm going to ask that we, figuratively speaking, move into a District 59 classroom. So as you can see in our visual, this represents a classroom with 20 students. And one of those students, shown in orange, is a student with a positive COVID-19 case. In this classroom, our students are 3 feet apart. And we have been notified that we have a positive case, so that child is going to go home into isolation immediately, and our job will be to contact trace and determine if there are any students who were in close contact who will now need to quarantine. When we do that, in a situation where everyone in school is in masks, we have 2 main factors that we need to look at. We first determine what students or staff were within 6 feet. Then we need to determine if any are fully vaccinated. If they are, they will not quarantine. If they are not fully vaccinated, we need to determine if they are going to meet the criteria for the close contact exception. So we're looking at, were they at least 3 feet apart? If they were not able to maintain 3 feet apart and be fully masked, there would be quarantines, which means that those people in close contact would be staying home for at least 10 days. If they were able to maintain 3 feet apart and all were fully masked, there would be no quarantines, and we would ask those close contacts to monitor their symptoms for the next 14 days while they attended school. When masks are optional, we introduce another factor. We now need to determine for close contacts if any were fully vaccinated, and again, they would not quarantine. Then we need to determine, was the close contact at least 3 feet apart? If the answer is no, they would quarantine. If the answer is yes, we now need to look at, were both people fully masked? Was the person who had COVID fully masked, and was the person in close contact fully masked? If that answer is yes, there may be no quarantines, and they would monitor symptoms. If that answer is no, there would be quarantines, and that quarantine would be 10 days out of school. So we have a different number of factors that we're looking at, depending on if we are fully masked or not. So let's look at what this decision-making looks like in our classes. And again, this is a class of 20. That's not how all of our classes will look, but for the purpose of demonstrating quarantine situations, that is our setup for tonight. They are 3 feet apart, and we have 1 positive case, again indicated by the orange. You can see that all of these students are fully masked. In this case, everyone qualifies for the close contact exception. Because they are 3 feet apart, because the close contacts are fully masked, and because the person who's COVID positive is fully masked, there will be no quarantines in this situation. The student who is positive will go home into isolation immediately. Now moving into our next situation. Here in our same classroom, we have optional masking. You can see that our student who is COVID positive has their mask on. You can see students around that are in close contact. Some have masks, some do not, representing a mask optional setting. In this case, we have several students who do not meet the criteria for the exception that would need to quarantine. So our student who is COVID positive would go home, as well as the 4 other students who are not wearing masks, and they would need to quarantine for at least 10 days. Now let's look at the same situation with one change. In this scenario, the student who is COVID positive is no longer wearing a mask. Because we cannot guarantee that both the COVID positive person and those in close contact are all fully masked, regardless of whether students chose to wear a mask or not, all students would need to quarantine. So everyone within 6 feet in this situation will need to go home for at least 10 days because we cannot guarantee that the person who is COVID positive and all others were fully masked. Now we're going to introduce another mitigating factor. We heard Dr. Bresnahan talk about 3 things: our vaccines, our physical distancing, and our masking. So now if we introduce vaccines into our classrooms, which this would represent our junior high classrooms where we have many students who are 12 and older and eligible to get a vaccine, that also impacts who would quarantine and who would not. You can see in our graphic that students who have their vaccines have their "I got my COVID-19 vaccine" sticker on their shoulder. They are in gray here. We have students who are masked, and we have a student who has no mask, and our student who's positive has their mask on.
Dr. Ossil, if I could just pause 1 second.
Please.
This is just for the visual. We are not planning on identifying in any way our students, whether they are vaccinated or not. This is purely for the visual on the screen. Okay, so thank you, Dr. Ossil. Continue.
Of course. So in this case, the students who have their vaccines do not need to quarantine. Anyone who is vaccinated will not need to quarantine for close contact. We have several students with their masks on, and our student who is COVID positive has their mask on, so those students will not need to quarantine either. However, we have 1 student who is not fully masked. That student would quarantine for 10 days. So in this case, our student who's COVID positive goes home, as well as 1 other student who did not meet the exception of being fully masked and 3 feet apart. And in our final scenario, we look to a time when vaccines will be more widely available. As I said, right now we have vaccines optional for those who are 12 and up. We know that hopefully this fall, maybe this winter, we will have vaccines optional for younger children. And at that time, we may see ourselves in this situation in which we have 1 student who's COVID positive. Everyone around that student has their vaccine, so regardless of mask status, none of them will need to quarantine. Our role right now is balancing our 3 major mitigating strategies: physical distance, vaccines, and masks. Some are more in our control than others. We cannot control when approval comes for younger students for vaccines, but we can make our decisions regarding masking and physical distance, which we will maximize to the fullest extent. These are all the scenarios I have for us tonight, and before I conclude, I want to remind everybody that these are generalities. When we contact trace, we work with our local health department, and we review everything on a case-by-case basis. We look at all individual factors and work with them to make our final decisions. Hopefully, these visuals were helpful in demonstrating the impact of various mitigating strategies on our student quarantines.
Thank you, Dr. Ossil. So in looking at this based on the scenarios and going back to our primary goal, which is to have students return to full in-person learning and then stay in school for in-person learning, it is really important. Thank you. It is really important that we look at the layers of mitigation, because no one strategy by itself is going to be foolproof. But when we look at layers, that's where we can really get a more robust opportunity to keep our kids in schools. This is based on the CDC guidance, which has been fully adopted by ISB, as well as IDPH, as well as our Cook County Public Health Department. So the recommendation from CDC and those other organizations is for masking for all individuals regardless of vaccination status when inside school buildings. A key factor and the return this year to a little more typical is that masks will be optional while they are outdoors. So students have been already very well adapted to that procedure over at Ridge and having that opportunity to have mask breaks when they're outside as well as when they are eating. Physical distancing continues to be one of the factors that we try do the best possible of keeping students at least 3 feet apart while indoors, 6 feet while eating. Again, that's to reduce and prevent as many quarantines as possible. The next layer is COVID testing, which we have not fully implemented or begun to implement, but at this point we are working with an organization called Shield Illinois. Many districts throughout Illinois began using this testing protocol in the spring. It is available to schools at no charge, and it is available to all students and staff who are unvaccinated. And they actually have staff that come in and are able to run the testing protocols within a school with minimal use of District 59 staff. So we are in the process of looking at adding those layers and exploring options to provide that. No testing would be done on a child without explicit parent or guardian permission. Hand sanitizing and washing, we know that that continues to be one of the best ways to keep ourselves healthy, not just for COVID, but in general. So we continue to provide those opportunities, as well as maintaining our high level of cleaning procedures that we had in place. And then also important to note is our air quality. We have one of the highest rated level filtration systems in our buildings for our filters. And we also had an extensive amount of upgrades done to our HVAC systems to also help improve airflow and air quality in all of our schools. The most important thing is that a lot changes and it changes very quickly. So as Mr. Ludloff had shared earlier, it's really important that we continue to monitor our guidance, not make rash or rush decisions, but to really be reflective and look at how can we begin to reduce our mitigation strategies. And that really means that we need to look at our current guidance from our local health department. We need to watch for improving trends in our health metrics. We also want to monitor how many people are we able to have participate in our screening or diagnostic COVID testing. And then also look at what opportunities can we provide and what are the rates of participation for the vaccinations as they are available and as future availability presents itself. So we will continue to monitor and adapt, and that's why this plan is designed to get us open, get us into the start of school, let us have a return to full in-person learning, because the last day we had full in-person learning was in March of 2020. And so that opportunity to have our staff open our schools, know that we're doing it in the safest way possible is a vital importance to us as an administrative team and for our staff. And all of this is so that we can focus back on learning. Our students had a very disrupted year last year, and we want to make sure that we're able to really look at what did they learn, what didn't they learn, and how can we accelerate that learning to make up for some lost time and really bring our attention back to in-person learning. So I'm going to turn it over to Ms. Savage for our plan on our acceleration of learning.
Thank you, Dr. Bresnahan. That is indeed the case, that we're really focusing on that in-person, full instruction. And in order to look at what that looks like in our district, we have sort of the what and the how that we're putting in place. The curriculum has been revised, and it's focused on the essential learning targets that are included in all of our scope and sequences for staff to access. In addition, we have adopted the illustrative math curricular resource that also aligns and has been connected to the essential targets. So they're in order for the teachers to use, and they're ready to go. In addition, we've also been focusing on our K2 foundational skills scope and sequence so that we are providing explicit instruction in phonemic awareness and phonics in those primary areas. So that's the what in general. It's much broader, but that gives you a little update of what that looks like. Then I like to look at the how. How are we putting this in place? And that would be the delivery of instruction.
Thank you, Mrs. Savage. The last piece is just really our commitment to communication, because we know that that really is a fundamental part of how we are going to continue to serve as partners in providing the best education for our students. Guidance, with it rapidly changing, we really are committed to ensuring that we provide thoughtful and timely communication, as well as opportunities for our families to provide input and feedback back to the schools so that, again, we can serve as partners in creating the healthiest environment possible for our students.